Okay, so I'm doing my health history video. My paper is here. It has nothing written on it. So I'm going to start. Knock, knock, knock. Hi, my name's Melissa. I'll be your nurse today. Can I get your name and date of birth?
My name is Imani Rue. My date of birth is 4/1997.
Okay, I'll check her wristband to make sure it matches. So can I ask you for your chief complaint why you came in today?
I'm having a little bit of back pain.
Okay, can I ask when the back pain started?
I would say I've had back pain for a few months now.
A few months. Do you know maybe the cause of the back pain?
I'm really not sure. It's just kind of like painful.
Did it just happen out of
It
nowhere?
just kind of started. I didn't really hurt myself or anything.
Okay, so on a scale from 0 to 10, 0 being the lowest and 10 being the highest, how would you rate the pain?
I would say it's about a 5.
About a 5. And have you tried any medication to cure the pain?
Sometimes I'll take like some Aleve.
Some Aleve. Do you follow the directions on the box for the right dosage?
Oh yes, I never
Okay.
take more than I'm
Oh,
supposed to.
great. And have you tried any non-medicational things like heating pad
I
or
have a
ice
heating
pack?
pad.
A heating pad. Does it seem to work?
It does kind of relieve the pain a little bit.
That's good. And do you think the back problems are hindering you from your everyday activities or everyday living?
No.
No. Okay. Well, I'll write all of this down and I'll take it to the doctor when I'm done with my health history assessment, and he'll come in and talk to you about
Okay.
it. So, do you know any do you have any past history illnesses that you know of, such as diabetes, high blood pressure, sickle cell, anything like that?
No.
No, you're pretty healthy. That's wonderful. And are you currently on any medication?
No.
And are you currently taking any vitamins or supplements?
No.
Okay. And do you know if you have any known medicational allergies?
I don't have any allergies at all.
And no food ones either?
No.
Okay. And are you currently vaccinated?
Yes, I'm up to date on all of my vaccines.
Do you have a flu shot?
Yes, I get a flu shot every year.
Wonderful. I was going to offer you one. And do you have any known family history with anything?
No.
Nope. Okay, that's great. So I'm going to start my assessment. I'm going to ask you a couple questions if you could just answer to the best of your abilities and things like that. So can I start by asking, have you had any recent fatigue?
What's fatigue?
Fatigue basically means sluggish and tired.
Oh, no.
Any weakness?
No.
Any changes in your weight?
No.
And have you noticed any irregular things with your skin, such as rashes, boils, lesions, or things?
No.
And I know it's winter. Do you notice any dryness?
Um,
Excessive dryness?
No, not excessive dryness.
And have you recently had any head injuries?
No.
No head injuries. And are you having any headaches?
No.
Okay. And are you currently experiencing any blurred vision or loss in sight? Okay. And any loss in hearing or balance?
No.
Okay. And do you have any like sinus allergies?
No. No.
So you don't
allergies.
experience any nasal drainage or things like that?
No, just regular runny nose when it's cold outside.
Okay, that makes sense. And do you experience any sores or lesions in your mucus area, which is your mouth?
No.
Okay, wonderful. Do you experience any neck stiffness, morning or night?
No.
Okay, any lumps around the thyroid area?
No. It's pretty normal.
Pretty normal. Okay, that's good. And as far as breathing, do you feel like you breathe pretty normal, or do you feel like do you feel shortness of breath sometimes?
No.
No shortness of breath?
Maybe after I like run up the steps or something.
I think that's normal for everybody. Do you feel like you have any trouble breathing when lying down
No.
on your back? And do you have excuse me. Okay, we'll come back to respiratory, okay? And as far as your heart, do you feel like you're having any heart palpitations? Which basically means irregular heartbeat. Do you have a history of high blood pressure or anything? Okay. Do you have normal bowel movements?
Yes.
Can I ask how often?
Every day.
Every day? Okay. And do you notice any recent diarrhea or constipation?
No.
Any blood in the stool?
No.
Okay, great. Have you noticed any muscle cramping? muscle weakness?
No.
Any uncontrollable sweating?
No, excuse me. No.
No. Okay. Have you noticed any changes in your urinary output? So have you noticed you've been urinating too much at night?
No.
Any blood in the urine?
No.
Do you feel like you can't control your urine output? Like, is it easily coming out or?
No, I can control it.
Oh, great. And are you noticing any muscle stiffness?
No.
Do you notice any tremors, which basically means like shaking? Do you have a history of any seizures in your family or with
No.
yourself?
No.
Great. And I would like to ask, have you had any recent signs of depression or feel depressed?
No.
Do you have any anxiety?
Like normal anxiety, like maybe if I have a test coming up or something important at work.
Okay, but not overwhelmed panic anxiety, right?
No, no panic attacks.
Okay, and do you have you ever had any thoughts of suicide?
No, I don't have.
That's good. And you mentioned before you haven't had any loss in vision or any blurred vision. Have you had recently experienced loss of consciousness?
No.
Okay. And no head injuries. Have you experienced any imbalance when walking? Okay. Are you experiencing any anemia? Anemia.
What is anemia?
Oh, that basically means like, have you experienced like fingertips being cold? Are you extra cold?
No.
No, nothing like that. Any loss of sensation in the fingertips?
No.
Any loss of sensation in the toes?
No.
Okay. Okay. Well, thank you, Imani, for this for allowing me to come in here and get an assessment on you. I'm going to get all of this to the doctor. He'll come in and he'll do what he has to do.
Okay.
So yes, thank you.
Thank you.